Hi, I'm Dr. Robert Fallis, and I'm here to introduce myself and to talk a little bit about my medical career. I've been performing medicine now for 34 years, and I've had a real unique and varied career. It really started when I trained in family medicine in a residency and lent into a family medicine practice for about 14 years. During that time, I also had the ability to work half-time in the emergency department. So really a nice blend of the chronicity of family practice, but also some of the acuity and the suddenness of things that present to the emergency department. During the time in family medicine, I had a couple come to me, and unfortunately they wanted to get a vasectomy, and the waiting time then was about 6 months. They actually got pregnant waiting for the vasectomy. So it led me to look into another option, and at the time there was a new procedure brought to North America called non-scalpel or no-scalpel vasectomy. This was a new approach to doing vasectomies, and I was one of the first providers in Canada to do so. I then provided the non-scalpel vasectomy under the vasectomydoctor.com banner for about 18 years. Also during the family practice time, men's sexuality changed in North America with the introduction of things such as Viagra, Cialis, and Levitra, helping men with erectile dysfunction that they've had problems with in the past and never had a solution for. This was an exciting time for men and a new change. Following my family practice years, I led into some urgent care practice, and this was a nice blend as well in that it had some chronicity and chronic illness that you have in family practice, but also the ability to do some acute work such as suturing and whatnot that you have in the urgent care clinic. It was a really nice blend and almost like days of old with the emergency department. I had a chance to write some books during this period of time, and I was thrilled when they became bestsellers in the Canadian marketplace. These books dealt with the most common health concerns at various life stages. The books opened up a number of doors for me in the media, both with radio vignettes under the Your Home Doctor banner and a magazine column called Your Health Matters. Probably the nicest thing that happened as a result of my books was the invitation to become the medical expert for Cityline on City TV. At the time, it was the most popular daytime television show in Canada. It was also live TV. So a bit stressful because not only did we have questions from the host, Marilyn Dennis, but also from the studio audience and call-in questions as well. And these dealt with everything from children's health, women's health, or men's health. You had to be on your game. For the past 18 years, I specialized in addiction medicine, and I've been helping people deal with difficulties with drugs and alcohol problems, specifically through the opioid epidemic we've had over the last 10 to 20 years. It's also allowed me the opportunity to treat men with something called opioid, which is OPIAD, opioid-induced androgen deficiency. This is like a testosterone deficiency that happens when people are on long-term opioids, and whether it's chronic pain or the use of illicit drugs can become a significant problem. To me, the 34 years of practice has really been a nice transition into men's health. And to me, it's a natural progression for things I've been doing for such a long time. Men are extremely unique and have unique concerns and questions. Creating Transform Men's Health provides an ability to deal with these concerns and concentrate on prevention. Focus on problems that men have that people continue to say are natural aging, but really have an efficient and safely treated option. Virtual health and telemedicine is also perfect for men, as they are less likely to have a family doctor, and they're always looking for a safe, secure, and confidential way of dealing with their problems. I was approached by Dr. Larry Comer, who's been running the Masters Men's Clinic for many, many years. He's the one who convinced me that we really need more people involved in men's health to deal with these common problems that they have. We're trying to help men live their best lives. At least that's our plan. Here we go.